In its weekly Flu View report, the Centers for Disease Control and Prevention said 22 states, mostly in the Midwest and Southeast, reported a high level of influenza activity. Some other numbers to know: the CDC says the flu is widespread in 36 states. 15 children have died from the flu so far this season, and the total number of deaths attributed to the flu hit 6.8% this past week. That's the exact percentage where the CDC declares an epidemic.
Wow, a flu epidemic is tearing across the United States. You just heard in that report, a total of 15 child deaths have been reported across 9 states so far. A number that is expected to rise into the spring. Joining us now on Midpoint, she is emergency medicine physician at Cooper Hospital, Dr. Katherine Schultes. Dr. Schultes, thanks so much for joining us.
Thanks for having me.
Why is the flu so severe this year and striking so hard so soon?
I mean, each year there can be difficult, there can be more prevalence of the flu strains, but this year the H3N2 virus is the one to blame. And it's a specific type of the flu strain that research are showing that the vaccine hasn't been able to target. The vaccine's produced a year in advance where you predict what type of flu vaccines will be popular, and it looks like this year this H3N2 virus mutated before they were able to produce the vaccine.
Well, some years the flu vaccine is very effective. So what went wrong this year?
So they think that this H3N2 strain mutated right after they had already produced the vaccine, and thus, based on the mutation, the vaccine isn't able to target the strain.
So we still got months to go in the flu season, obviously, and a lot of people are trying to debate now, first of the year, whether they should still get this flu shot. Good idea?
It is a good idea. In fact, it's the only protection against the flu is to get the flu vaccine.
When you recommend to your patients to get a flu vaccine, and I know a lot of times there are certain ages that maybe are more susceptible of getting the flu, what are some of your recommendations? Who should definitely get the flu vaccine?
So definitely anyone younger than 5 and anyone older than 65 are huge at-risk populations. And then anyone with chronic illnesses like diabetes, asthma, COPD, heart disease can get more consequences from the flu.
And it's available in the shot or the nasal spray this year?
Correct.
Okay. If you're lucky enough if you're unlucky, I should say, to come down with the flu, are antivirals such as Tamiflu a good or a bad idea?
So there's a lot of kind of mixed reviews about these antivirals like the Tamiflu. Some say that they shorten duration of flu-like symptoms for about 24 hours. Others say that they cause like a less severe case of the flu. But there are side effects like just vomiting, nausea, diarrhea. So we often have an open communication with our patients when they do test positive for the flu if they want to start this, the antivirals. And then the other thing is that they're only usually effective within the first 48 hours of symptoms. So people that come in for about a week of cough, congestion, fevers, they're kind of out of luck to start these antivirals.
Well, how much longer do we have to wait for a new flu vaccine if the last one isn't very effective?
Till next year, unless this H3N2 proves to be, of epidemic proportions where like the H1N1 where they created another vaccine. But right now, it looks like so far we're just gonna have to tough it out for another year.
All right, still a good idea to get a flu shot. So knowing that, what are some other things that we can do to reduce the risk of catching the flu?
Definitely. Good hand hygiene is super important. You can often contract the flu by if you cough and then touch a handrail, someone touches that, you touch your face, that can cause you to get the flu. Also, avoiding crowded spaces. And then for those people that are sick, stay at home. Don't make other people contract the flu as well.
I always hear that, make sure you stay at home. What's like a good benchmark for people to get back out into the workplace or go back to school? What are some things that you want to see before you allow your patients to get back into the population?
I mean, we usually tell them to listen to their body. When you get the flu, you feel like you've been hit by a truck. If you're able to get out of bed, you don't have any more fevers, you feel like eating, taking in good fluids, then I would say you're okay to go back to work.
And then I often hear that you should almost wait 24 hours since you've had no headaches or no nausea. Is that correct? Or it's just those initial stages you can get right back out there?
I would say, within 24 hours of starting to feel better, I would say you're okay to go back to the workplace.
All right, that's such a big thing, obviously. We don't want sick people going to work, but sometimes people feel guilty. They've missed too many days, so they'll get back out there. Dr. and Katherine Schultes, we really appreciate it, from Cooper Hospital in Philadelphia. Thank you so much for all your time and attention today. And stay safe, stay healthy, and all our viewers out there, hope you take some of those precautions outlined by Dr. Schultes. When we return, can outside sources really be a factor in certain cancers, or is it simply a matter of genetics and time? It's straight ahead.